The topic we are going to discuss is about food poisoning. The contents to be covered here include the causes of food poisoning, their diagnosis, general treatment measures, prevention of food poisoning, and types of food poisoning. Food poisoning usually refers to an acute illness which is caused by the consumption of food or drinks contaminated with pathogens, biochemical toxins, or toxic chemicals. The affected individuals usually show gastrointestinal symptoms, and the incubation period usually varies from hours to days depending on the causative agents. Coming to causes of food poisoning, they are usually caused by fish, chemical additives, plants, fungi, parasites, and microbes like bacteria, viruses, and protozoa. Moving on to how to diagnose a food poisoning, first patient history is collected and a clinical picture is also obtained. Stool analysis can be done and suspected food or agent analysis can also be detected. It can also be diagnosed by using measurement of serum electrolytes. Under general treatment measures, first oral dehydration therapy can be recommended for mild dehydration, which is 3 to 5% of fluid deficit, or moderate dehydration, which is 6 to 10% of fluid deficit. Rehydration should commence with a fluid containing 50 to 90 MEq per liter of sodium. Also, the amount of fluid administration should be 50 ml per kg over a period of 2 to 4 hours in mild dehydration and 100 ml per kg in moderate dehydration. After 2 to 4 hours, hydration status should be assessed, and if it is found to be normal, maintenance therapy can be begun. Maintenance therapy usually includes 1 ml for each gram of diarrheal stool, 10 ml for a kg of every watery stool passed, and 2 ml for kg of each episode of vomiting. Limitations: it is not sufficient therapy in the presence of dysentery, shock, intestinal ileus, intractable vomiting, high stool output, monosaccharide malabsorption, and lactose intolerance. Moving on to intravenous rehydration, this is usually administered in cases of severe dehydration, usually when the patient experiences greater than 10% of fluid deficit or shock. In this condition, 20 ml per kg bolus of Ringer's lactate solution, a normal saline or similar solution, can be administered until the pulse, perfusion, and mental status return to normal. Oral rehydration can commence when the condition improves. Food poisoning can be prevented by taking the following measures. Buy groceries only from hygienic outlets and store it immediately in the refrigerator. Do not buy items whose expiry date has been elapsed or contain undercooked or raw animal-derived ingredients. Also, buy only pasteurized milk or cheese, and do not buy eggs which are cracked or leaking. Place the eggs inside cartons and store them in the main section of the refrigerator. Meat and seafood should be cooked and washed thoroughly before eating. Also, reheat food or heat partially cooked foods at least up to 74 degrees Celsius. Wash hands and utensils and counters with water and soap between preparation of different foods. And also, wash fresh fruits and vegetables under running water and avoid consumption of uncooked animal-derived ingredients. Bacterial type of food poisoning. Many types of bacteria like Bacillus cereus, Staphylococcus aureus, and Vibrio cholerae cause food poisoning. Bacillus cereus occurs through sources like meats, vegetables, and fried rice. The incubation period is usually 1 to 6 hours in emetic form and 16 hours in diarrheal form. Clinical features usually include nausea, vomiting, watery diarrhea, abdominal pain, and fulminant liver failure. Illness usually resolves in 24 hours, and antibiotic therapy is not generally indicated. Other treatment measures include antiemetics for controlling nausea and vomiting. Staphylococcus aureus causes food poisoning through sources like salads, pastries, ham, poultry, etc. The incubation period for this type of bacteria is 1 to 6 hours, and the clinical features include nausea, severe vomiting, salivation, cramps, diarrhea, etc. Illness usually resolves in 24 hours, and antiemetics can be given to treat nausea and vomiting in this condition too. Clostridium perfringens, the source is meats and poultry, and the incubation period is 6 to 24 hours. Clinical features also include nausea, vomiting, acute abdominal cramps, diarrhea, gas gangrene. An antibiotic therapy is not indicated in this case, and supportive measures can be recommended. For Vibrio cholerae, the common source is usually food and water, and the incubation period is 16 to 72 hours. Clinical features include profuse or painless watery diarrhea and vomiting, colorless stools with mucus. Under treatment, a single dose of oral doxycycline 300 mg is the preferred agent. In children and pregnant women, erythromycin and azithromycin can be used, and in areas of high tetracycline resistance, fluoroquinolones are effective. Medications like antiemetics, antidiarrheal, and antispasmodics are contraindicated in this condition and hence should not be used. The Salmonella species causes food poisoning by the consumption of eggs and dairy products. Here, the incubation period is usually 16 to 48 hours. Vomiting, crampy abdominal pain, diarrhea, slimy loose stools, and foul smell are the characteristic symptoms. Under treatment, antibiotics are generally not indicated in this condition. They are used only in the following cases like bacteremia, AIDS patient, elderly, infants, and individuals with sickle cell disease. Anti-motility agents should not be used as they contraindicate this type of food poisoning. The Shigella species causes food poisoning through fruits, vegetables, and milk, and the incubation period is usually 16 to 48 hours. Abdominal pain, tenesmus, fever, watery stools, or bloody diarrhea are the common signs and symptoms. The preferred agents of the choice are fluoroquinolones. Ciprofloxacin 500 mg is taken orally every 12 hours into 5 days. Levofloxacin 500 mg is taken orally for 1 day into 5 days. Norfloxacin 400 mg orally is taken every 12 hours. Antimotility agents should not be taken in this case. E. coli is usually transferred through water and food, and the incubation period is 16 to 72 hours. The common signs and symptoms include cramps, bloody diarrhea, fever, vomiting, and fatality. Medications usually include norfloxacin 400 mg or ciprofloxacin 500 mg orally twice daily for 3 days, or azithromycin 500 mg orally once daily for 3 days. In addition, rifaximin 200 mg can also be taken thrice daily for 3 days. Loperamide and bismuth subsalicylate can be used to decrease the severity of the diarrhea. Moving on to protozoal food poisoning, the first causative agent is Entamoeba histolytica. Here the source is contaminated food and water, raw vegetables which have not been washed properly, and human-to-human transmission can also occur. The incubation period is usually 2 to 4 weeks, and intestinal amoebiasis, mild abdominal discomfort, diarrhea, dysentery, amoebiasis involving the liver, lungs, brain, spleen, etc. are the common symptoms. Treatment usually includes metronidazole 30 mg per kg for 8 to 10 days or tinidazole. Abscesses must be treated surgically, and asymptomatic carriers can be treated with diiodohydroxyquine or dilonaxide furoate. Moving on to Cryptosporidium parvum protozoa. This protozoa causes severe diarrhea in immunocompromised adult patients and immunocompetent children. The source is usually contaminated food and water. Clinical features include severe persistent diarrhea, malnutrition in case of children, pulmonary manifestations, toxic megacolon, and cryptosporidiosis in often fatal in AIDS patients. Treatment includes IV fluids and electrolytes, and also antidiarrheal drugs. Coming to microsporidia, the clinical features include diarrhea, keratoconjunctivitis, hepatitis, myositis, ascites, cholangitis, renal or urogenital infections. Treatment usually includes albendazole, which is 400 mg taken twice daily. The third causative agent, viral food poisoning. Common viruses causing food poisoning include adenovirus, parvovirus, and rotavirus. Rotavirus is the most common cause of diarrhea disease in infants, and adenovirus is another common agent of diarrhea disease in children. The incubation period for both the viruses is from 24 to 72 hours. Clinical features include vomiting and diarrhea, which lasts for 4 to 7 days. Stools are watery and foul smelling. Treatment include self-limiting and require only rehydration. Infants must be administered oral rehydration solutions, while older children should include bananas, rice, apple, tea, toast in their diet. The parasites causing Japanese restaurant syndrome usually includes roundworm and fish tapeworm. For roundworm, the causative is consumption of fish, and symptoms usually include nausea and vomiting. It is usually diagnosed by larvae on endoscopy or laparotomy, and treatment options include niclosamide and paracequantal, which are recommended to be effective. For fish tapeworm, the signs and symptoms include nausea and vomiting, and they're diagnosed by the identification of tapeworm proglottids in the stool. Paromomycin is recommended as the first-line treatment option. Moving over to fungi or mushroom poisoning, the term mushroom usually refers to the reproductive portion of a fungus which grows below the mycelium. Almost less than 5% of mushrooms are reported to be poisonous. It can either cause mild to moderate self-limiting gastroenteritis, and depending on the nature of toxins present, mushrooms can be classified into the following groups: Amanita species, Galerina species, Lepiota species, and toxins usually include amatoxins, phallotoxins, and virotoxins. Under mechanism of action of all the toxins that are present in the mushrooms, phalloidin are reported to be most rapidly acting, while amanitin has delayed manifestations. Phalloidin interrupts the actin polymerization and impairs the cell membrane function, but it has limited absorption and toxicity. It binds to the actin F, which is filamentous polymer of the plasma membrane, and hence increases the permeability of the plasma membrane of hepatocytes. Amatoxins are more potent and can cause hepatic, renal, and CNS damage. Under diagnosis, Meigs's test is recommended for detecting amatoxins, but false positive reactions can also be possible. Meigs's test is used to detect an amyloid reaction in cyclopeptide containing amatoxins. Hepatic and renal function test can also be recommended. Serum electrolytes, urea and creatinine, and also glucose level should be detected. Drop of material mushroom dish gastric contents or stools should be placed on slide and absorbed under high power magnification, which helps in revealing the spores. Detection of toxins in the gastric aspirate, serum, urine, stool and liver and kidney biopsies using high performance liquid chromatography or thin layer chromatography or RIA test can also be performed. Coagulation parameters should also be monitored. The severity classification for mushroom poisoning can be classified according to the following grades. Under grade 1, gastrointestinal upset is present. In grade 2, all signs of intoxications with a mild to moderate rise in transaminases, which is less than 500 units per liter, is usually present. For grade 3 includes severe hepatic damage with a grade increase in transaminases, which is greater than 500 units per liter, plus an impaired plasma clotting function. Grade 3A constitutes bilirubin rise is mild or absent, while grade 3B, bilirubin rise is deep and continuous, which is greater than 5 mg per deciliter. In grade 4, there is a steep rise in transaminases, which is accompanied by a steep decline in clotting function, a steep rise in bilirubin, an onset of kidney dysfunction, and the patient usually have a poor prognosis and may die despite intensive care. The clinical features of mushroom poisoning are classified into 3 phases. The phase 1 includes abdominal pain, nausea, vomiting, diarrhea, fever, hypoglycemia, hypotension, and electrolyte imbalance for 1 day. Severe diarrhea and watery and cholera-like stools are also present. Metabolic acidosis can also be seen. In phase 2, Tucker's phase of remission usually occurs. Clinical features of phase 3 mushroom poisoning include hepatic, renal, and pancreatic failure for 2 to 3 days, and hepatotoxicity for 7 to 10 days. Coagulation defects with hypofibrinogenemia can also occur. Other symptoms include lactic acidosis and metabolic acidosis, hypoglycemia, cardiovascular collapse, polyneuropathy, renal failure, and fetus toxic hepatitis. Coming on to treatment, first stabilization is done, which includes restoration of fluid, IV glucose administration, and due to coagulation defect, hemorrhage can also occur, which should be treated with vitamin K 50 to 100 mg per day IV and fresh frozen plasma. Correction of hypokalemia should be done by using solutions of dextrose 5% or NaCl 0.9%. Metabolic acidosis can be corrected by using sodium bicarbonate solution 1 to 4%. Secondly, decontamination can also be done. It includes administration of activated charcoal or multiple dose activated charcoal. Forced diuresis can also help if the patient is presented within 24 to 48 hours because of significant amounts of amatoxins are eliminated in urine. Hemoperfusion is also beneficial if performed within 24 hours. Charcoal plasma perfusion and continuous veno-venous hemofiltration are also advisable in this case. Other medications administered include thiotic acid, which is alpha-lipoic acid, silibinin, cimetidine, dosage 4 to 6 grams per day, which is a potent cytochrome P450 system inhibitor and has hepatoprotective effects against alpha-amanitin. N-acetylcysteine can also be administered in these conditions. Root of Indian plant, which is Picoriza curavo, contains an iridode glycoside mixture that has been shown to be hepatoprotective in certain situations. Acubin, which is an iridode glycoside obtained from the leaves of Acuba japonica, is protective against Amanita intoxication and is being tested in dogs. For the treatment of cerebral edema, intracranial pressure monitoring is done, and also osmotic diuretics such as mannitol 1 gram per kg is given in rapid IV infusion of 20% solution. Barbiturates like IV thiopental, dosage 3 to 5 mg per kg, is infused slowly over 15 minutes until the signs of raised ICP resolves. Corticosteroids may also be helpful in relieving cerebral edema due to acute liver failure. Proper positioning of the patient, that is head upright, is recommended, and for treating infections, antibiotics or prophylactics can be administered depending on the situation. For treating coagulopathy, fresh frozen plasma can be administered in serious or persistent bleeding. Liver transplantation can also be considered as a treatment option in case of mushroom poisoning. The following conditions require liver transplantation: grade 2 encephalopathy and beyond, prolonged prothrombin time which is greater than twice as normal, serum bilirubin greater than 25 mg percentage, azothemia, evidence of acidosis, hypoglycemia, gastrointestinal hemorrhage, and hypofibrinogenemia. Other treatment recommendations include molecular absorbent regenerating system, short-term extracorporeal hepatic support like liver dialysis, methods of removing protein-bound substances in patients with liver failure and hepatic encephalopathy. It employs an albumin-impregnated highly permeable dialyzer with albumin-containing dialysate recycled in a closed loop with a charcoal cartridge, an anion exchange resin absorber, and a conventional hemodialysis membrane.